it is essential to consult with. Repeated tissue stretching could cause. These are key components at the root of this pain. This will not show up on medical imaging, which is why it is absolutely necessary to. I'm sick, I can't stop coughing, and now my chest hurts.
I can't go out. I'm sick.
So here's the story of how I managed to get through it. Am I the only one, or has this ever happened to you? Feeling pain in your ribs, in your back near the spine, on the sides, or even in the front around the sternum when coughing, and even afterward like something is off? Why does this happen? And more importantly, is it serious? Give me a minute. I'm heading to my clinic and I'll explain everything about this type of pain that patients tend to freak out about and what you can do to relieve it. 1.5 billion people worldwide live with chronic pain. If you enjoy my content, subscribe. It takes just 1 second. But most importantly, leave me a comment to let me know you've subscribed and share this video on social media. You can even create short videos from it. Help spread the message to reach and support as many people as possible. Finally, every month I offer a free consultation to one person via video call or directly at my clinic. Let me help you better understand your neuro-musculoskeletal pain and provide you with personalized tools to manage it at home. To participate, subscribe to my YouTube channel and leave a comment under the video mentioning that you subscribed and describing the issue you'd like to discuss. Finally, to double your chances, visit www.cliniquepsb.com, go to the health articles section, sign up for my clinic's health newsletter, and choose an article to leave a comment with your YouTube username. Good luck to all! Before delving into the neuromusculoskeletal causes of rib pain associated with a persistent cough, which fall within the expertise of chiropractors, let's first address more serious conditions that can prolong a cough. These conditions must be treated as a priority before considering other approaches. When a persistent cough is accompanied by rib pain, it's essential to rule out serious pulmonary diseases that require urgent intervention. Among these are pneumonia, a lung infection that can cause fever, shortness of breath, and chest pain. Pulmonary embolism caused by a blood clot blocking a pulmonary artery may also present with a dry cough, sharp chest pain, and sudden difficulty breathing. Finally, pneumothorax, or collapsed lung, occurs when air accumulates between the lung and chest wall, leading to sharp pain and shortness of breath. These conditions require immediate diagnosis and treatment to prevent potentially life-threatening complications. That said, it's important not to provide information that might simply cause unnecessary fear, as this can undermine your autonomy and inadvertently contribute to the strain on the public healthcare system. So remember that the intensity of pain is not a reliable indicator of severity. Symptoms such as a high fever above 39.5 degrees Celsius, persisting for more than 48 hours without improvement, combined with nausea, vomiting, or shortness of breath during light to moderate activities, are much more concerning. In such cases, it is crucial to promptly consult a nurse practitioner, your family doctor, or visit the emergency room. Now that we've ruled out serious causes, let's examine the 3 common mistakes people make when experiencing back or rib pain associated with a persistent cough. These include assuming the pain is due to a fractured rib, a displaced vertebra, or a pinched nerve. These assumptions are misleading because unless there has been significant trauma, such as a violent accident or fall, or neurological symptoms like loss of strength, reflexes, numbness, or tingling, the source of the problem is rarely linked to these simplistic explanations. These widely held health myths often offer a misguided interpretation of complex and poorly understood pain. The complexity lies in the fact that certain anatomical structures can become irritated or sensitive due to mechanical overload, such as persistent coughing. This overload exceeds the normal capacity of these structures over time. In response, the brain triggers a cascade of protective mechanisms aimed at shielding your body by controlling your movements and environment to reduce the risk of further injury. The affected structures are located around the rib cage, and one or more of them may, either simultaneously or alternately, cause pain. The first component could be the muscles located between the 12 pairs of ribs. Coughing is a natural reflex designed to protect the airways and lungs. When you're sick, irritants such as mucus, dust, particles, or even infectious agents, viruses, bacteria, can accumulate in your airways. Coughing helps expel these irritants, clearing your bronchial tubes and throat to facilitate breathing. In cases of infections like the common cold or flu, coughing is often triggered by inflammation and irritation of the respiratory mucosa. However, for this process to occur, the muscles between the ribs must contract to allow a rapid expulsion of air from the lungs. Persistent coughing can overstretch and sensitize this region temporarily. Muscle stretching and resulting sensitivity are sometimes mistakenly referred to as minor sprains, but they are simply non-specific muscular pain. This excessive contraction of muscles during coughing can also irritate certain joint structures, which in turn may become another source of non-specific pain. For example, the junction between the sternum and the ribs, known as the costal cartilage, as well as the joints between the thoracic vertebrae in the dorsal region, can become sensitive due to the repetitive back and forth motion. This irritation may cause localized pain in the front or back of the chest, on the right or left side of the spine. Finally, a body weakened by the constant effort of fighting a respiratory illness like the flu or others may have reduced tolerance to stress. As a result, even small, seemingly insignificant movements can become the last straw, triggering pain in other areas such as the neck, lower back, shoulders, or other non-specific structures that may also become irritated and temporarily painful. It is important to understand that all these sources of non-specific pain are temporary. Your ability to regain control of the situation will be essential in minimizing the time spent dealing with these discomforts. Remember, muscle and joint pain do not resolve through inactivity. Psychological yellow flags, such as believing that physical activity, exercise, or movement could worsen your condition, are myths that will only delay your recovery. It is entirely possible to move within a comfort-discomfort zone, using pain as a guide to determine your limits. While this approach may be challenging and require extra effort, it will be a key factor in a faster recovery. Since this situation is temporary, you may also consider conservative care to help relieve symptoms. Such treatments can sometimes speed up pain relief, but they will never replace what time and your body's natural healing abilities can achieve on their own. If you haven't realized it yet, when it comes to public health, the most impactful way to promote autonomy within the population and reduce the costs associated with overconsultations and the strain on healthcare triage systems is information. That's why it's urgent to subscribe and click the notification bell so you don't miss any of my future videos. I know the concept of non-specific pain has come up several times in this video. If you'd like to better understand this type of pain, the link should be available now. In the meantime, feel free to share your story, comments, suggestions, or simply ask if you still have any questions. Because with knowledge, you build your autonomy, navigating your health with more certainty.